This is the audiobook version of Gastrointestinal Radiotherapy made easy. Welcome messages. This booklet introduces you to radiotherapy treatment for gastrointestinal cancer, including how, when, and the side effects of the treatment. Additionally, it offers a straightforward and accessible guide to understanding gastrointestinal cancer and the treatment journey involved. Thus, please sit back and relax while enjoying our booklet. Radiation therapy, or also known as radiotherapy, is a type of cancer treatment. It uses high-energy rays, like X-rays, to target and destroy cancer cells. The goal of radiotherapy is to treat the cancer while sparing nearby healthy cells as many as possible. External beam radiation therapy most often uses X-rays. This treatment uses a large machine called a linear accelerator, LINAC. What is gastrointestinal cancer? Gastrointestinal cancer, or also abbreviated to GI cancer, refers to the uncontrolled growth of abnormal cells, cancer, in the digestive system. These cancers can occur in different parts of the gastrointestinal tract, which spans from the mouth to the anus. Each type of GI cancer has distinct characteristics, symptoms, and treatments. GI cancers can be investigated through esophagogastroduodenoscopy, EGD, esophagography, ultrasound, CT scan, and PET scan. In this book, we will talk about the esophageal cancer, gastric cancer, liver cancer, pancreatic cancer, and anal cancer. Esophageal cancer refers to the abnormal growth of cells that starts in the esophagus. The esophagus is a long, hollow tube that runs from the throat to the stomach. The risk factors of esophageal cancer are tobacco and alcohol consumption, Barrett's esophagus, or chronic gastroesophageal reflux disease, GERD, consumption of hot drinks, family history of gastrointestinal cancer, human papillomavirus, HPV, infection, and occupational exposure to chemicals. The sign and symptoms of esophageal cancer are difficulty in swallowing, hoarseness and cough, unexplained weight loss, worsening indigestion or heartburn, and vomiting blood. The treatment options for esophageal cancer are surgery, which is known as esophagectomy, radiotherapy, and chemoradiation. The radiotherapy dose prescription for esophageal cancer, 45 gray at 25 fractions in 5 weeks. Note that the treatment is individualized to best fit each patient's need. Stomach cancer, or also known as gastric cancer, is an abnormal growth of cells that begins in the stomach. The risk factors of gastric cancer are excessive tobacco and alcohol consumption, having excess body weight, Helicobacter pylori, H. pylori infection, and chronic gastritis. The sign and symptoms of gastric cancer are difficulty swallowing, nausea and vomiting, unexplained weight loss, severe abdominal pain, loss of appetite, worsening indigestion or heartburn, blood in the stool or vomiting blood, feeling full after consuming a small amount of food, and fluids build up in abdomen, ascites. The treatment options for gastric cancer are surgery, which is gastrectomy, and radiotherapy. The radiotherapy dose prescription for gastric cancer is 45 gray at 25 fractions in 5 weeks. Please note that the treatment is individualized to best fit each patient's needs. Pancreatic cancer begins in the pancreas. The pancreas lies behind the lower part of the stomach. It consists of exocrine cells, the cells that produce digestive enzymes, and endocrine cells, which are the cells that produce hormones. The risk factors of pancreatic cancer is excessive tobacco and alcohol consumption, obesity, dietary factors, history of diabetes or chronic pancreatitis, and family history of pancreatic cancer or pancreatitis. The sign and symptoms of pancreatic cancer are jaundice, unexplained weight loss, severe abdominal pain, light-colored stools, and dark urine. The treatment options available for pancreatic cancer are surgery, such as Whipple procedure or pancreatectomy, radiotherapy, and chemoradiation. The radiotherapy dose prescription for pancreatic cancer is 45 gray at 25 fractions at 5 weeks. The treatment is individualized to best fit each patient's needs. Cancer that starts in the liver is called primary liver cancer. The most common type of primary liver cancer is hepatocellular carcinoma, HCC. The risk factors: chronic viral hepatitis infection, HBV and HCV, cirrhosis, excessive tobacco and alcohol consumption, obesity, aflatoxins from nuts, and anabolic steroid. The sign and symptoms of liver cancer are pain in the upper right abdominal, loss of appetite, unexplained weight loss, nausea and vomiting, yellowing of the skin and eyes that caused by jaundice, pale bowel movements and dark urine, and swelling of the abdomen due to fluids buildup or known as ascites. The treatment options for liver cancer are surgery, such as hepatectomy, ablation therapy, radiotherapy, chemotherapy, and transarterial chemoembolization, TACE. The radiotherapy dose prescription for liver cancer is 54 gray at 30 fractions in 6 weeks. The treatment is individualized to best fit each patient's needs. Anal cancer is cancer that starts in the anus. The anus is the part of the large bowel which stool exits the body. The risk factors of anal cancer are human papillomavirus, HPV, infection, taking immunosuppressants, engaging in anal sex, and anal fistula. The sign and symptoms of anal cancer are rectal bleeding, lump or mass near the anus, discharge from the anus, itching or pain around the anus, and changes in bowel habits. The treatment options for anal cancer are wide local excision, radiotherapy, and chemotherapy. The radiotherapy dose prescription for anal cancer is 50 gray at 25 fractions in 5 weeks. Please note that the treatment is individualized to best for each patient's needs. Radiation oncology is built up from a multidisciplinary team, which include radiation oncologist, radiation therapist, medical physicist, surgeon, and radiation oncology nurse. Radiation oncologist manages cancer treatment by prescribing and supervising a course of radiation therapy. Radiation therapist plans and delivers radiation therapy to the radiation oncologist's prescription. Meanwhile, the role of medical physicist is to ensure treatment machines are working accurately and safely, oversees safe delivery of radionuclide therapy, and monitors radiation levels. Surgeon surgically removes tumors and performs biopsies if needed. And the radiation oncology nurse provides care, information, and support for managing side effects and other issues throughout radiation therapy. Let's know about your rights throughout radiotherapy. You have the right to access care and humane support, to receive treatment without discrimination of race, religion, gender, ethnic origin, nationality, to access healthcare regardless of social, physical, and mental status, to be treated with care, respect, and dignity, and to be given emotional and psychological support as part of care process. You also have the right to participate in decision-making, to be provided with a translator if needed, to be accompanied by family member or guardian during consultations, to be actively involved in the treatment decisions, and to have the right to accept or to refuse the treatment. Next, you have the right to continuity of care, to receive seamless care across different stages of cancer or treatment and between different healthcare providers. Other than that, you have the right to information and safety, to be given accurate information on health status and treatment plans, to learn more about the alternative treatment options, to receive relevant information prior to any procedure, and to receive a summarized patient bill. You also have the right to privacy and confidentiality, to have your medical records remain confidential. Last but not least, you have the right to informed consent, to be given enough time to ask questions and consult family opinion, and to have a second opinion from other healthcare professionals. So, since you will start your radiotherapy journey very soon, what else do you need to prepare? As a mental preparation, you need to set a positive mindset. Be open to share your feelings with your family and ensure you have a clear plan for treatment days. In terms of physical preparation, you may maintain a healthy diet and always stay hydrated. Try your best to get 7 to 8 hours of rest every day and prepare for the procedure by following any specific instruction mentioned by the healthcare personnel. Let's get an overview on the radiotherapy workflow. It mainly consists of 5 steps, which are consultation, simulation, planning, treatment, and follow-up. Each of the steps will be given a more detailed explanation soon. Consultation. The radiation oncology team will consult with you regarding the treatment plan for your cancer. Depending on the stage of your cancer, you may receive radiotherapy alone, chemotherapy, or a combination of both. The oncology team will explain the purpose of radiotherapy, expected outcomes, potential side effects, and alternative treatments. Several tests and evaluations may be conducted to assess your condition, which will determine the appropriateness of radiotherapy and plan for the treatment. Some of the common tests include imaging tests, such as CT scan, MRI, PET-CT scan, or X-rays. Laboratory tests, such as complete blood count, tumor markers, and respiratory motion assessment. It's important to discuss all treatment options, including their goals and possible side effects, with your doctors to help make the decision that best fits your needs. Next, let's learn about what is simulation. Before starting radiotherapy, we need a detailed scan of your body to plan the treatment accurately. This is called a simulation. You will undergo a CT scan while lying in the same position as during treatment. To keep you still and comfortable, our team will use special supports and positioning devices. Here's what to expect during this session. For upper gastrointestinal cancer, such as esophageal, gastric, and pancreatic cancer, you will need to do preparation by removing jewelry, bra, and any metal objects. Then change your outfit into a hospital gown. You will be positioned by lying on your back, arms above your head, holding a bar. A cushion will be placed under your knees. If your treatment area includes the head and neck, such as cervical esophageal cancer, you may need to wear a special plastic mask to help keep you still. You may feel warmth as it molded to fit your face. Stay still for about 20 minutes. You can breathe and talk normally. If you have a persistent cough or sneezing, let our team know. It may need to be managed before we can proceed. Some patients may need a device that gently presses on the abdomen to reduce organ movement during breathing. This may feel slightly uncomfortable, but slow, steady breathing helps. Important reminder: your setup and position during simulation will be exactly the same during treatment. If an immobilization mask is used in simulation, you will wear the same mask for each treatment session. For lower gastrointestinal cancer, such as colon, rectal, and anal cancer, you need to prepare by removing jewelry, bra, and zippered pants. Then, change your outfit to wear a hospital gown. You will be requested to drink certain amount of water and wait until your bladder feels full and empty your bowels before the scan. You will be positioned to lie on your back and hands resting on your chest or hold a ring. A cushion will be placed under your knees and a vacuum bag or leg support may be used for stability. Do you wonder why to drink 500 milliliters of water before the scan? Drinking water helps fill your bladder, which moves healthy organs away from the tumor. This reduces unwanted radiation exposure and helps improve your treatment results. A tip for you is to wait until you feel a strong urge to urinate before the scan. This makes a big difference in reducing side effects. Also, do you know why do you need to empty your bowel first? A full rectum, large intestine filled with stool, can push the tumor out of position, making treatment less accurate. To avoid this, use the toilet before your scan and before every treatment session. Tips: if needed, you may be advised to use an enema laxative to clear your bowels before the scan. A last tiny steps of simulation after the scan, our radiotherapy team will make tiny permanent tattoo dots on your skin to help guide your treatment. When marked, these marks are about the size of a freckle and feel like a small mosquito bite. Let's proceed to treatment planning. During this process, you will not be directly involved. Our medical team, consisting of physicists and oncologists, will work on your CT scan from the simulation and carefully plan your radiotherapy. They will determine the best technique used and treatment plan for you using previous imaging, such as MRI or PET-CT. Normally, this planning process takes about 2 to 4 weeks before your first treatment session. After the medical physicist has done the treatment planning, you will be given an appointment date to begin your radiotherapy. The most common radiotherapy technique used in GI treatment consists of three-dimensional conformal radiation therapy and intensity-modulated radiation therapy. Three-dimensional conformal radiation therapy is a technique that uses imaging technology to shape radiation beams to match the three-dimensional shape of a tumor, where each session lasts about 10 to 20 minutes. In 3D CRT, radiation is delivered from multiple angles to achieve better tumor coverage while reducing the dose to surrounding tissues. 3D CRT is widely used to treat esophageal cancer, rectal cancer, liver, and stomach cancer, whereas IMRT is an advanced form of 3D CRT that adjusts the intensity of each radiation beam for higher precision. This technique may last about 15 to 30 minutes. Radiation intensity varies across the beam, focusing higher doses on the tumor while reducing exposure to nearby critical organs. IMRT is commonly used for cancers located near critical organs or in areas requiring high precision. Other advanced techniques include volumetric modulated arc therapy and stereotactic body radiation therapy. For more info, you may scan the QR code on page 17. Moving on to the treatment day. Before treatment, you need to confirm your appointment and wait until the treatment team calls you when they're ready. You may also need bowel and bladder preparation, which you can confirm with your radiation therapist if you need to keep your bladder full or your bowel empty. Next is to change into a hospital gown, and you are required to remove any accessory near or at the treatment area. Make sure to place them in a secure place. What happens during treatment? First is positioning, where your body will be positioned in the exact position with the same immobilization devices as your simulation session. Once your position is secured, the radiation therapist will leave the room. Worry not, you will be monitored from the CCTV. Should you encounter any problem, you can raise your hand. Before treatment start, radiation therapist will take either 2D or 3D image of the treatment area to verify your position. What you'll experience during the treatment is that the machine may move around you, making soft whirring or buzzing sounds. You won't feel the radiation, and it's completely painless. Breath normally. For most GIT cancers, you can breathe as usual, but in some cases, you might need to follow specific breathing instructions. Duration of each session with positioning and setup The whole session usually takes about 15 to 30 minutes. After treatment do's and don'ts. After the treatment include don't use any soap, ointment, lotion, or moisturizer, and avoiding scrubbing the treated area. Do adjust your diet to reduce stomach or bowel irritation. E.g., avoiding spicy or high-fiber foods can help with diarrhea. Do have enough rest and do light exercise like walking to help manage fatigue. Finally, do drink enough water to reduce dry cough and voice hoarseness. Is resimulation for you? Repeat CT scan or resimulation is necessary after the initial planning scan due to various clinical, technical, and patient-related factors. It ensures that the treatment plan remains accurate and effective as changes occur during the treatment course. You may need a resimulation if your tumor shrinks due to tumor response or treatment progression, anatomical shifts or changes in organ position, any significant weight changes that alter the target and surrounding organ structure, post-surgical, after unplanned surgery, or other interventions during the treatment course. Side effects. Side effects of radiotherapy can be generally categorized into two: acute and late side effects. Acute side effects typically happen during or shortly after the treatment period. Common examples are skin reaction at the treated site, nausea and vomiting, fatigue, and loss of appetite. Late side effects often happen months or years after the completion of treatment. Sometimes it will lead to chronic complications that might impact the quality of life. Late side effects normally occur depending on the treated site. The examples of side effect esophageal cancer include swallowing difficulty, scarring of the lungs, and esophagus narrowing. Side effects of stomach cancer includes ulceration, gastritis, gastric outlet obstruction. Meanwhile, for liver cancer includes radiation-induced liver disease, scarring of liver tissue, and secondary cancer. Pancreatic cancer includes bowel damage, decreased function of liver, and decreased function of kidneys. Anal cancer includes bowel dysfunction, urinary burning or frequency, and sexual organ dysfunction. Supporting care. By addressing your physical, emotional, and social needs, we wish to improve your quality of life by providing you a holistic care and supporting your journey to fight cancer. First, symptoms management. Here are some suggested non-medicated management for light symptoms. If you experience fatigue due to radiotherapy, you will require to rest well and do light exercises regularly. For skin redness side effects, you may clean the treated site with warm water and avoid scratching if feel itchy. Medications to reduce the symptoms will be prescribed by your doctor based on the severity. Secondly, psychological and emotional support. It is a natural process for you or your family member to worry on your health condition. Experted team could give you psychological support, counseling, education, or other approaches to help you cope with the psychological or emotional issues. Do not hesitate to talk with your cancer care team so that they could help you to get a right support. Third, nutritional support. Healthy diet is important for cancer patients to obtain sufficient nutrient and energy intake. A meeting with dietitians will be scheduled for you if your body weight has lost drastically due to the radiotherapy side effects. Dietitians will provide solution for your nausea, diarrhea, or lost appetite problems.
Fourth, rehabilitation and physiotherapy. Oncology rehabilitation focus to manage and improve the impairments and physical limitations due to the development of tumor or side effect of the cancer treatment. Maintaining physical activity is important to reduce fatigue and improve ability to do daily tasks. Fifth, speech therapy. Swallowing difficulty is one of the side effects of radiotherapy on esophageal cancer. Speech therapist could solve your problem by swallowing therapy. Through the introduction of new methods to help you in swallowing, your swallow abilities could be preserved and you could re-strengthen your muscles in neck region. And the last supporting care that we could provide is financial support and consultation. Paying for the cancer treatment could be a challenge for you and your family. Here are the approaches that you could get financial aid on your medical bill. Subsidies from government hospitals. Subsidies from Ministry of Health. External organizations, e.g. Rotary Cancer. Welfare Fund, KALSIS. Follow-up. The follow-up care is essential to assess your recovery. Monitor for side effects or complications. Check for signs of recurrence or progression of cancer, and to conduct imaging tests, lab work, or physical exams as needed. Follow-up may be done for every 5 sessions of treatment, a few weeks after the completion of radiotherapy, every few months after treatment, and annual checkups. Regular follow-ups help detect and address the possibility of cancer returning back. Consistency is the key because every process directly impacts the effectiveness, outcome, and safety of treatment. Frequently asked questions, FAQ. Question 1. Will the radiation remain in my body after the treatment? No, radiation does not stay in your body after external beam radiotherapy for gastrointestinal cancers. The radiation affects the targeted area only during treatment, and once the session ends, there is no residual radiation in your body. Question 2. Do I need any surgery? For some earlier stage cancers, surgery can be used to try to remove the cancer and some of the normal surrounding tissue. In some cases, it might be combined with other treatments, such as chemotherapy and/or radiation therapy. Question 3. Can I choose to stop my treatment midway? For some people, when treatments have been tried and are no longer controlling the cancer, it could be time to weigh the benefits and risks of continuing to try new treatments. Whether or not you continue treatment, there are still things you can do to help maintain or improve your quality of life, and we are here to support your journey. Question 4. What can be done to prevent the development of these cancers? In general, leading a healthy lifestyle, weight control and reduction, and avoidance of known risk factors are recommended. In addition, timely management of pre-malignant conditions associated with different GI cancers is recommended. Question 5. What are the common risk factors associated with the development of cancers? Different cancers have different risk factors, however few common associations are seen. A few common associations that are attributed are the use of tobacco products, smoking, alcohol, obesity, chronic inflammation, radiation exposure, or the use of immunosuppressive agents. Question 6. Will radiotherapy affect my ability to have children? Radiotherapy for certain GI cancers, such as anal cancer and colorectal cancer, may affect fertility since the treatment area is near the pelvis, potentially impacting reproductive organs. However, fertility is usually not affected for most GI cancers. Discuss fertility preservation options with your doctor before starting treatment if you're concerned. Here comes the end of gastrointestinal radiotherapy made easy. We would like to present you a quote, "You're stronger than you ever realized, without a doubt." Thank you for your attention.